Good afternoon. The topic for today's class is about analgesics and anti-inflammatory drugs. So in the last class, we had seen about the introduction to anti-nociceptive drugs. And we have seen that the anti-nociceptive drugs are classified into two types. The first type was the NSAIDs, which are also known as the non-narcotic drugs, and the second type was the opioid analgesics, which are also known as the narcotic drugs. Now, in today's class, we are going to see in detail about the first category of drug in the first lecture, and in the second lecture, we are going to cover the second category of drug, that is the opioid analgesics. So, the first lecture will be about the non-narcotic drugs or the NSAIDs, and the second lecture will be about the opioid drugs or the narcotic drugs, opioid or the narcotic drugs. Now, before we start with the actual NSAIDs, we are again first going to revise what do we mean by pain, inflammation, and what is the mechanism which causes pain. When we understand the complete mechanism of pain, how pain is caused in the body, then it will be easy to understand how the painkillers act in the body. So coming to pain, the medical term for pain is known as analgesia. Now, pain, as you all know, it is an unpleasant sensation. It causes discomfort and it is not liked by any person. But at the same time, pain also serves as a protective function to the body because the body tries to protect itself by showing that there is some presence of harmful stimuli or there is a presence of a tissue damaging condition, whether it is resulting from external or internal stimuli. The body responds to it by giving pain so that the person comes to know that there is something wrong in the body which is has to be taken care of. So it is an important symptoms which it is an important symptom that takes the patient to the physician or the doctor. So whenever a pain is felt, then only the patient approaches the doctor. If there is no pain and something is going wrong in the body, the person will not come to know. So the body responds to any noxious stimuli. The body responds to any tissue damaging condition by showing or by developing pain so that the person comes to know that there is something wrong in the body. If the person is suffering with excessive pain, that will be unbearable and it can cause many other side effects such as apprehension, sweating, palpitation, sinking sensation, excuse me, sinking sensation. All these things will be seen when a person suffer with excessive pain. Sinking sensation means depressing sensation. Okay, apprehension means an unpleasant sensation or anxiety or fear, something like that. So all these things are seen when a person is suffering with excessive pain. Now, what is the function of analgesics? Analgesics are those drugs which relieve the pain, but they relieve the pain as a symptom. So they reduce the pain, but without affecting the actual cause. So what is the cause? Analgesics are not bothered about that. They do not remove the actual cause of the pain. Their function is to just reduce the pain. But what is the actual cause of the pain? That has to be diagnosed and treated. But for temporary relief, analgesics can be given to reduce the pain. Similarly, inflammation. Inflammation is also a protective response from the body to any injurious stimuli, to any noxious stimuli. And inflammation may lead to heat, fever, swelling, pain, and redness in that particular area. What is the function of anti-inflammatory drugs? These drugs, they reduce inflammation and swelling, and the anti-inflammatory drugs make up about half of the analgesics, remedying pain by reducing inflammation. So most of the analgesics are anti-inflammatory also, or you can say anti-inflammatory drugs are half of the analgesics. So most of the analgesics are having a combination of analgesics and anti-inflammatory drugs. That means they reduce the pain and inflammation at the same time. So the analgesic drugs, they selectively relieve pain. Now where do these analgesics act? They can act either centrally or they can act peripherally. Central analgesics are the opioid analgesics, the narcotic analgesics, or they are also known as the morphine-like analgesics. These are the central analgesics, that means they act in the brain. They are classified into two types depending upon their structure, the phenanthrene derivatives and the benzoisoquinoline derivatives. And the examples are morphine, codeine, thebaine. They are included under the phenanthrene derivatives. Papaverine and noscapine, they are included under the benzoisoquinoline derivatives. These are all the central analgesics. Now coming to the second type, that is the peripheral analgesics. Peripheral analgesics are also known as the non-narcotic drugs, or they are known as the non-opioid drugs. And the best name is the NSAIDs, that is non-steroidal anti-inflammatory drugs. They are also known as aspirin-like drugs. So all these drugs are compared to aspirin. That is why they are known as aspirin-like drugs, or aspirin is considered as the prototype drug of the peripheral analgesic category. These are divided into three types: the selective COX-1, the preferential COX-2, and the selective COX-2. Now, what is COX? COX is an enzyme. The COX is an enzyme. The full name is cyclooxygenase, COX, which denotes cyclooxygenase enzyme. So selective COX-1. So this cyclooxygenase enzyme is of two types, COX-1 and COX-2. That is cyclooxygenase 1 and cyclooxygenase 2. So what are these category of drugs doing? They are inhibiting cyclooxygenase 1. They are inhibiting cyclooxygenase 2. So that is why they are classified according to which enzyme they inhibit. If they are inhibiting cyclooxygenase 1, that is, if they are selective in inhibiting cyclooxygenase 1, then they are classified into the first category, that is selective COX-1 inhibitors, aspirin, indomethacin, brufen, and diclofenac. Prefer excuse me. Preferential COX-2 inhibitors. They prefer inhibiting COX-2 enzyme. Examples are nimesulide and meloxicam. Selective COX-2 inhibitors. That means they are selective in inhibiting cyclooxygenase 2 enzyme. Example are celecoxib and rofecoxib. So the peripheral analgesics are classified depending upon which enzyme they inhibit, whether they are inhibiting cyclooxygenase 1 enzyme or they are inhibiting cyclooxygenase 2 enzyme. Other analgesics, within the other analgesic category, we have paracetamol, or which is also known as acetaminophen. Now, what is the mechanism of pain? So first we should understand what is the mechanism of pain. And in the previous slide, we have seen that the drugs are inhibiting cyclooxygenase enzyme and reducing pain. So we must know what is the importance of cyclooxygenase enzyme. Why are all drugs going and targeting this cyclooxygenase enzyme? What is the role of cyclooxygenase enzyme in developing pain? And when it is inhibited, how the pain is reduced. So to understand that, we are first going to see what is the mechanism of pain, how pain is caused. So nociceptors, we have seen earlier that nociceptors are the pain receptors or the pain detectors which are present in every tissue of the body except the brain. So they are the receptors for pain and they are free nerve endings. They are found throughout the body. So whenever there is a tissue injury or any irritation, it releases chemicals. The body cells or the body tissues, they release chemicals in response to any tissue injury or irritation. What are the chemicals released? Prostaglandins, kinins, and potassium ions will be released. These chemicals, they stimulate the pain receptors. That is, they stimulate the nociceptors and then the person will feel pain. But here in this mechanism, we do not have the cyclooxygenase. So we have to see in detail what is actually happening to release these chemicals. So we will see in the next slide what is the mechanism and what is the role of cyclooxygenase. So this is a brief mechanism. Any injury or any irritation leads to the release of chemicals and these chemicals will stimulate the pain receptors, that is nociceptors. When the nociceptors are stimulated, the person will feel pain. Now, what is the function of prostaglandins? Now, these prostaglandins are released in response to any injury or irritation. So, their function is they promote inflammation, pain, or they may cause fever. The other functions are they act along with the platelets and blood clotting factors to cause the clotting of the blood. That is the second function of prostaglandins. And they are protective in nature. They specially protect the lining of the stomach by inhibiting or by reducing the damaging effect of the acid in the stomach. So it, apart from producing or promoting inflammation, pain, and fever, it helps in blood clotting and also it protects the lining of the stomach from the damaging effect of acids. That are the functions of prostaglandins. Now, we have to see what is the importance of cyclooxygenase enzyme. Why are the drugs inhibiting the cyclooxygenase enzyme? So here we will see what is the actual role of the cyclooxygenase enzyme. So if there is an injury, infection or any trauma, it will attack the cell membrane. So the cell membrane will be attacked or the cell membrane will be the first thing to be attacked to an injury, infection or any trauma. Now this cell membrane contains phospholipids. Phospholipids are nothing but they are a type of lipids and they have a head and two tails. So these are phospholipids. Now these phospholipids, because the cell membrane contains phospholipids, these phospholipids will be activated whenever there is an injury or infection. and these phospholipids leads to the formation of arachidonic acid. Now, phospholipids, how do they form arachidonic acid? In the presence of cyclooxygenase enzyme. Cyclooxygenase 1 and cyclooxygenase 2. So both these enzymes helps to form the arachidonic acid from excuse me, from phospholipids. So arachidonic acid is formed from phospholipid in the presence of the cyclooxygenase enzyme. This arachidonic acid leads to the production of prostaglandins, and these prostaglandins, they promote inflammation, pain or fever. So in the previous slide we had seen that any tissue injury leads to the release of chemicals, that is prostaglandins. But in between these two steps, there are all the steps which I mentioned in the next slide. That is, it attacks the cell membrane, the phospholipids will be activated, it leads to the formation of arachidonic acid, and then in the presence of this arachidonic acid will be converted to prostaglandins in the presence of cyclooxygenase 1 and cyclooxygenase 2. So these cyclooxygenase plays an important role in the formation of prostaglandins. And then what do prostaglandins do? They promote pain, fever and inflammation. So the same thing is here. The membrane phospholipids, they are converted to arachidonic acid. Arachidonic acid is converted to prostaglandin in the presence of cyclooxygenase. So here comes the role of cyclooxygenase. Arachidonic acid converts to prostaglandins in the presence of cyclooxygenase 1 and cyclooxygenase 2. This prostaglandins helps to form or promote pain, swelling or inflammation. Now what are the drugs doing? As I told you earlier, all the drugs are targeting the cyclooxygenase enzyme. So now we know what is the exact role of cyclooxygenase enzyme. Cyclooxygenase enzyme helps to form prostaglandins. Prostaglandins promote pain and inflammation. So if prostaglandins are not formed, then what will happen? The patient will not feel pain or inflammation. So how can we reduce the number of prostaglandins? By inhibiting the cyclooxygenase enzyme. So that is why all the drugs are going and targeting the cyclooxygenase enzyme, reduce the release of prostaglandins to reduce pain, inflammation and swelling. So now you know what is the exact role of cyclooxygenase and why all the drugs are targeting the cyclooxygenase enzyme. So the primary mechanism responsible for analgesic action is to inhibit prostaglandin synthesis. How? By inhibiting the cyclooxygenase enzyme. So this is the major step in the to reduce the analgesia, that is pain and inflammation. Because the prostaglandin sensitize the pain receptors, their inhibition is necessary for the analgesic activity to produce analgesia and anti-inflammation to produce analgesia and anti-inflammation. It is necessary that the prostaglandin synthesis is reduced. So that can be reduced by inhibiting the cyclooxygenase enzyme. So NSAIDs block the cyclooxygenase enzyme, reduce prostaglandin, thereby they reduce inflammation, pain and fever. So this is the basic mechanism how these NSAIDs act. Now as I told you, prostaglandins are not only involved in promoting pain, inflammation, and fever, but also they have protective functions. They support blood clotting, they protect the stomach from the harmful effect of acids. So when prostaglandin production is reduced, what will happen? There can be harmful effect on the stomach. So prolonged use of NSAIDs can cause ulcers in the stomach, and they might promote bleeding also, because the good functions of prostaglandin, all the functions are good, but inflammation, fever, and pain are also a protective function. But in order to reduce these things, other things are compromised because they help in blood clotting. Now the levels of prostaglandins are reduced, so it might promote bleeding because they cause protective, because they have protective function in the lining of the stomach. Now the levels of prostaglandins are reduced, it might lead to ulcers in the stomach because no longer they can function as a protective no longer they can have a protective function in the stomach because their levels are being reduced because of the use of NSAIDs. Now coming to the first drug, that is aspirin. As I told you, it is the prototype drug. So all the drugs are compared with aspirin. So we will see the effects of aspirin in detail, and then we will see other drugs, how they are acting. So aspirin, when it is taken, it is rapidly deacetylated. That means the chemical structure of aspirin is converted by the enzyme esterases in the body, producing salicylate. Now this salicylate is having anti-inflammatory, antipyretic, and analgesic effect. Anti-inflammatory means it reduces inflammation. Antipyretic means it reduces fever. And analgesic means it reduces pain. So pain, fever, and inflammation all are reduced. These effects of salicylate are primarily due to blockade of prostaglandin synthesis. So we need not repeat every time that prostaglandin synthesis is blocked by majority or all the drugs by inhibiting the cyclooxygenase enzyme. So what are the actions? Anti-inflammatory, analgesics, and antipyretic. That means it reduces inflammation, pain, and fever. What are the pharmacological actions? The same thing, analgesia, antipyretic, anti-inflammatory. So it can be used for relieving dull, ache, throbbing pain, which might arise from muscles and joints, and also pain due to dysmenorrhea and toothache. All these pains can be reduced by salicylate drug. The prototype of all the drugs is aspirin. Antipyretic means it reduces fever. How does it reduce fever? By resetting the hypothalamic thermostat. So in the hypothalamus of the brain, there is a thermostat which helps to promote heat loss. So it resets that level, and it rapidly reduces the fever by promoting heat loss. How is heat loss from the body? By sweating and causing vasodilation. But the important thing is it reduces body temperature, or it reduces fever only in patients who have fever, and it will not affect the body temperature of normal individuals. That means if aspirin is taken by a normal individual, it will not further drop the body temperature. It is only effective in patients who have a high body temperature or who are suffering with fever. Anti-inflammatory and anti-rheumatic action. Aspirin produces both anti-inflammatory and anti-rheumatic action by inhibiting the prostaglandin synthesis and reducing the permeability of blood vessels. So it will tighten cells of the blood vessels, or it will reduce the permeability of blood vessels such that no liquid or no fluid flows out of the blood vessels into the tissue and cause inflammation. It suppresses the signs of inflammation like pain, swelling, tenderness, and vasodilation. So all these signs will be suppressed, and anti-inflammatory action is basically due to reducing the permeability of the blood vessels. So by tightening the blood vessels, it will not allow any fluids flow out of the blood vessels into the surrounding tissues. Next is GIT. What is the effect on GIT? So GIT, it is causing gastric irritation. It is resulting in dyspepsia, nausea, vomiting, ulceration, and GI bleeding. So all these things are happening in the GIT because the prostaglandins are inhibited, because the prostaglandins are having a protective function in the stomach. Now, when they are inhibited, it might lead to gastric irritation, nausea, vomiting, ulceration, bleeding, etc. But these things, they are like side effects. Okay, so these things can be minimized by taking the drug with plenty of water, or taking it after the food, or taking it with milk, or taking it with a sodium bicarbonate, that is a base, or taking a soluble or buffered aspirin, which can be easily soluble in the water, so that reduce its harmful effects on the GIT, or taking it with a prostaglandin analog, that is misoprostol. Misoprostol is a drug which acts as a prostaglandin analog. That means it is having a protective function on the gastric and the duodenal mucosa. So that drug can be given together with aspirin in order to reduce its harmful effects on the GIT. Now, on the blood, what is the action on the blood? It prolongs the bleeding time. Why does it prolong the bleeding time? Because actual effect of prostaglandin is to promote blood clotting. But now the levels of prostaglandins are reduced, thereby bleeding time can be prolonged. Why is this happening? Because the smallest dose of aspirin, it irreversibly inhibits the thromboxane synthesis in the platelets, and thereby they inhibit platelet aggregation and prolongs the bleeding time. So this is useful for people who have blood clotting problem or who have heart problem. For such cases, it is actually useful, but for normal individuals, what will happen? The bleeding time will be prolonged. So continuous administration predisposes to bleeding by decreasing the synthesis of clotting factors. So all these effects are seen with the salicylates on blood. Next, coming to the uses. So as we have already seen, uses, it is used as an analgesic in different types of pain such as headache, back pain, muscle pain, joint pain, etc. To reduce the fever, to reduce the rheumatic fever also, arthritis, post myocardial infarction, and post stroke patients. So as I told you, because it causes liquefaction of the blood, or because it reduces the blood clotting factor and promote bleeding, it can be useful for people who have thick blood or myocardial infarction or post-stroke patient. In such patient, a very minute dose of aspirin, usually 81 mg, is prescribed to take it daily to liquefy their blood. So it can be used for people who have heart problem. And if a topical application is used, it can be used to treat pimples, corns, and warts. So low doses are prophylactically used to reduce platelet aggregation. So people who have clotting problem, if their blood is getting clot in the arteries and veins, for such people, aspirin is prescribed in low doses to reduce platelet aggregation. Adverse effects. So salicylates causes respiratory depression. Hypersensitivity. Symptoms of true allergy such as urticaria. Urticaria is nothing but you know skin problem. Okay, so that occurs in people. Bronchoconstriction can be seen, angioedema can be seen, but anaphylactic shock is rare. So anaphylactic shock we already studied, so that is rarely seen with salicylates. The important side effect which is seen is Rees syndrome. This is usually seen in children. If aspirin is given with other salicylates during viral infections, then it is leading to Rees syndrome. What is Rees syndrome? Rees syndrome is usually fatal and it causes problems in the liver and cerebral edema. Okay, so it causes fulminating hepatitis and cerebral edema that is very fatal. That is fatal. So it usually occurs in children and it is seen with aspirin when it is given in children, especially during viral infections. Next, coming to the toxicity of salicylates. Now, there are two types of toxicities which are seen in salicylates. One is the mild and the other one is the severe. Mild toxicity is known as salicylum and severe toxicity is known as salicylate intoxication. So, what are the different symptoms which are seen? Sorry, what are the different symptoms which are seen in salicylism? Nausea, vomiting, hyperventilation, headache, dizziness, tinnitus are seen. Tinnitus is nothing but ringing or roaring effect in the ears. So these are the mild side effects which are seen. And what are the severe side effects that are seen with the salicylates? They are nothing but delirium, hallucinations are seen. That means the people hear and feel things which are actually not visible. Sometimes it can lead to convulsions, coma, respiratory depression, and respiratory failure. So these are the two types of toxicity which is seen with the salicylates, the mild and the severe. Mild is also known as salicylism. Severe is known as salicylate intoxication. Now, coming to the precautions and contraindications. Now, what can be done to reduce, or what can be done, what are the precautions that can be taken, and what are the contraindications of the drug? So, because it can cause peptic ulcer, because it causes bleeding disorders, and it causes chronic liver diseases, it should not be given in people who already have problems with the GIT, and it should also not be given in people who have glucose 6 phosphate dehydrogenase deficiency. If there is an elective surgery, if a person is undergoing surgery, then aspirin should stop at least 1 week before the surgery, because it might create a problem during the surgery as it promotes bleeding. So, before the surgery, aspirin has to be stopped. Next, coming to the second drug, that is brufen. So, brufen is also anti-inflammatory, analgesic, and antipyretic in nature. It also alters the platelet function and it also prolongs the bleeding time. What are the adverse effects? It causes dyspepsia due to GIT bleeding, headache, tinnitus, and dizziness are the adverse effects of brufen. Other drugs, that is indomethacin, sulindac, etc., they are also having the same use, analgesic, reduces fever and inflammation. But because it is having more toxicity when compared to other drugs, its use is only for treating arthritis and spondylitis. Next is the paracetamol. So paracetamol, as you all know, it is also an analgesic and antipyretic, but paracetamol will not have anti-inflammatory action, or you can say it will have negligible anti-inflammatory action. It is used to reduce all types of pain such as skeletal pain, pain during the menstrual cycle, and migraine pain. All these pains are reduced by paracetamol. Now it is more safe when compared to other drugs. So it will cause very less GI irritation. It will not have any effect on platelet function, and it is the most common drug which is used over the counter. And the most important thing is no risk of Reese syndrome is seen with paracetamol. So when compared to all other drugs, paracetamol is the most safest drug in children as well as in adults, because it will not cause GI irritation, it will not affect the platelet function, and it is adverse effects are very rare. Nausea, rashes occurs very rarely, and it is well tolerated drug. So among all the drugs, the most safest drug to be used for reducing pain and fever is paracetamol, but it is having negligible anti-inflammatory action. Coming to the selective COX-2 inhibitors, that is celecoxib, rofecoxib, and valdecoxib, they are also having the property of reducing pain, inflammation, and fever. They have low ulcerogenic potential, that means they will not cause GI ulcer, but they are more expensive than the NSAIDs, and their use should be restricted only to patients who do not tolerate NSAIDs. So if a patient is not able to tolerate any category of NSAIDs, then the selective COX-2 inhibitors can be opted for such kind of patients. So this is about the NSAIDs, or you can say the non-steroidal anti-inflammatory drug, the COX-1 inhibitors and the COX-2 inhibitors. So all the drugs, we are comparing all the drugs with aspirin. I mean, we have seen in detail about the effects of aspirin and very briefly the effects of different drugs. So, and we also know what is the actual mechanism for pain and inflammation, what is the role of cyclooxygenase enzyme, what is the function of prostaglandins, and why the drugs are inhibiting the cyclooxygenase enzyme, why the drugs are targeting only the cyclooxygenase enzyme, and what is the protective function of prostaglandins, and if these drugs are given, what harmful effects are seen on the body. So all these things are discussed, and I hope it is clear for all of you.